innovation. So we're going to start, and let me see what time we have. Okay, we're 4 minutes late already, so we're under pressure. So I'll just start by saying thank you so much, everybody, for coming today. This is a really important event, I think, for Ireland, as we launch Ireland's very first Femtech ecosystem. There has not been anything like this in Ireland before, and what we are doing today is bringing together the key elements that create an ecosystem, and that is the women themselves who will benefit from this, the enterprise and entrepreneurs and innovators who you'll hear from later today, the research community, and we're joined by Professor John Crine and Dr. Sally Cudmore, who's newly appointed as Director of UCC Innovation, and the clinical expertise that will be delivered through Ireland South Women's and Infants Directorate, facilitated by John Higgins, and you'll meet Katrina Heffernan later today, who will be enabling that with us. So I don't want to dwell too long on this, but just to say that there are lots of great things planned for this Femtech ecosystem. We want to put the really great activity that is already happening on the map, so that Ireland is part of the global Femtech revolution, as they're calling it, but also that we listen to some of the outputs of the Women's Health Task Force, which you'll hear from later today, and use that to inform how we create new solutions and new technologies in the future. Ireland is a fantastic place to innovate. We have the likes of Enterprise Ireland supporting our startup companies. We have the research ecosystem delivering new startups informed by research. And we have a fantastic clinical ecosystem as well that we've engaged with very much through Health Innovation Hub Ireland. And recently we launched with Enterprise Ireland a clinical innovation programme, and we had some fantastic ideas coming through that as well. So while we continue to do the work of Health Innovation Hub, we are also going to focus on this Femtech initiative, really delivering for the women of Ireland. But that doesn't mean, if you're a male, that you shouldn't be involved. We have 2 companies founded by males going to be presenting today, and you'll see how we all have a role to play in this. So to get on with the proceedings, I'm absolutely thrilled to invite Professor John Crine, who's the Vice President for Research and Innovation, to open the event. And I just want to say, John, thank you to you, the team at UCC, the researchers you hear from today, and the team at UCC Innovation for really supporting this. There wasn't even a question when we first mentioned it, so I really appreciate that. So thank you.
Thank you, Tanya, for those generous words, and kudos to you and the entire team for everything that has led up to today. And there's so much work behind the scenes in leading in this, and it's really important. And so I'd like, on behalf of University College Cork, to welcome you all today to the Dora Allman Room, which is one of our flagship meeting rooms now, named after our first female medical student. I wear many hats in the university. One of them is Professor of Anatomy. And so I don't need to tell you that there are differences between men and women in that regard. But here in this room just below used to be the old anatomy dissecting room up until about 10 years ago. And so there are many stories to be told, and many dead bodies, but hopefully we won't be raising any of them today in terms of what we're doing. But what I want to do is just welcome you all. There's a lot of people to welcome, and I'm sure I'm going to leave out some, but we have representatives from the Department of Health and the Department of Enterprise, Trade and Employment. We have representatives from many of our really key government agencies, Enterprise Ireland, the IDA, Science Foundation Ireland, HRB, Cork County Council and Cork City Council, Cork Chamber, the Health Innovation Hub Ireland partner institutions, which was really proud to really echo that this is, while we're very proud that it's based in UCC, this is a national endeavour. And so we have representatives from MTU, from the University of Galway, from Trinity College Dublin, as well as clinical locations throughout the region. We have Helen Donovan, CEO of the South Infirmary, David Donegan, the new CEO of Cork University Hospital, and colleagues from the Southwest Hospital Group, and representatives from the Women's Health Task Force. We also, as Tanya said, we have a wide variety of academic staff from these universities, including here in UCC, research staff, startups already working in the Femtech area, and large multinationals from the region. And finally, I want to welcome those who are critical to the success of Femtech and those who really are at the centre of it, which are the women. Whether you're a researcher, a clinician, an entrepreneur, a mother, a daughter, a sister, a mentor, you are the ones driving all of this. Men and women alike, together we collectively can help solve some of the key problems addressing women's health and deliver new innovative solutions. Some years ago I was invited to speak at the HIHI conference, which is a large conference to really try and promote STEM among school-age girls. And I was one of the few males on the panel, so I was thinking, what would I say? And then I started reflecting on all of the diseases that are out there. And we have a gendered response in many of the diseases we have. And I work in the area of mental health and neuroscience. And many of these disorders have a much greater preponderance among the female population than the male population. And why would we leave it to men to solve these problems when what we can see what Femtech can do overall? And it's really important for us here in UCC. We're one of the key aspects of what we do in research here is really have an engaged research program and be very much engaging with people with lived experience and understanding that and helping reaching out to women to help solve these problems is really important in this endeavour, as well as the variety of the patient participation networks that are really important in driving the innovation that we have. UCC has a really strong track record in research and innovation. We have the largest amount of funding in terms of direct interactions with industry in the country. We have the highest number of citations in the country in terms of what we do. And just last week, 14 UCC investigators were named on the world's most highly cited list. So we're very proud of what we're trying to do there. Our Ignite program enables graduates to develop their own startups, and I see Eamon Curtin here, and our Sprint and Gateway programs led out by Miriam Cronin provide training and space for startups to grow, and we're very proud that the Health Innovation Hub is really part of the entire innovation ecosystem that we have in UCC. We're also on a journey trying to make that ecosystem more coalesced and that we're, being better at shouting about what we can achieve collectively overall. And since 2016, the Health Innovation Hub has supported more than 400 based healthcare startup or SMEs supporting the economy and supporting our healthcare system through the implementation of innovative healthcare solutions. So that's really something for the entire team in HIHI to be so proud of where they have reached today. But today is a new dawn. It's a new phase of a specific area where they can actually lead nationally and internationally, and that's being part of the Femtech revolution overall. And this will continue to leverage the work that has been delivered up to now and will focus the spotlight specifically on women's health research where there is clear unmet medical needs overall. And it's bringing together the required components, the clinical expertise through the Ireland South Women and Infants Directorate, led out by Professor John Higgins, who has been instrumental in driving everything about the Health Innovation Hub since its inception. It brings together research within our community here in UCC and further afield and throughout the academic network in Ireland, and it brings innovation. And from UCC's perspective, we're very proud that we announced last week the first female leader of our UCC innovation, and that's Dr. Sally Cudmore, who you'll hear about later. The other part of the innovation ecosystem that we want to promote and do more in is in female entrepreneurship. And we really want to have role models like people in this room to push forward to actually solve these problems that are so important, not just for women, but for the entire of society. So this is really a timely initiative. Historically, only about 2% of the global research budget is spent on women's health. Women make up, as you know, 50% of the population, and so therefore they are. We need to make up that balance. It's just not adding up overall. And as I alluded to, women are disproportionately affected in certain disorders, whether that goes from Alzheimer's and dementia to multiple sclerosis, depression, breast cancer, and osteoporosis. And so we have a long, long way to go, but it's only through innovation can we actually get there. And we need to do that collectively across the entire life cycle of innovation, from the idea all the way to getting the product and the applied aspects of where we go. And so that will allow us to develop new treatments, new innovations, and new solutions, and new ideas about bringing things together. And so we in UCC have set out a new way of, an exciting way of prioritizing our research within what we're doing, and it's called the UCC Futures Program. And within that, we've called out areas like future medicines. But it's about being able to predict that through interdisciplinary research, bringing the right components with an innovation backbone, we can actually drive towards solutions that are going to have global impact overall. And so I really look forward to see what will emerge from this initiative in the future, and you're really welcome today. So thanks very much for inviting me to speak.
Thank you so much, John. And I think the words about 2% of the global research budget only being spent on women's health is something we need to look at, and I'm glad that we're making the first step here to change that. So a couple of months ago, when we sat down to talk to Taoiseach Micheál Martin about the activity in the Health Innovation Hub, we mentioned Femtech, and he was very animated about it and interested in it. So although he can't be with us here with us today, he spent some time to send us this message in relation to the launch of the initiative. So are you guys able? Do I need to do that? Sorry.
I'm delighted to welcome the launch of the new initiative, Femtech, at Health Innovation Hub Ireland. Health Innovation Hub Ireland has been an important player in the Irish health tech sector since 2016, and now with today's launch is taking another important step forward in developing Ireland's health innovation environment. By promoting the design and development of new high potential products and services aimed at women and girls, this new Femtech initiative has the potential to help enable a more equal healthcare system. And it's not before time. Historically, development and investment in exclusively female-focused health tech has been as low as 2% of total investment. A person's sex can have a significant impact on their health needs and service requirements. So I'm very pleased that here in Ireland, through this initiative, we can help to begin addressing this imbalance. It is imperative that all of our citizens can access high-quality, state-of-the-art healthcare from cradle to grave. The government I lead will continue to work hard to ensure that everyone in our society with female healthcare needs can access high-quality services and supports. In March of this year, we launched the Women's Health Action Plan 2022 to 2023, a plan which focuses on improving health outcomes for women in Ireland, addressing maternal health, sexual and reproductive health, and wider measures, for example, breastfeeding supports and new menopause clinics around the country, as well as a whole suite of mental health and well-being initiatives. Ensuring access to and high-quality provision of improved women's health services and supports is a key priority for government. This work can be complemented by the development of new and more advanced female-centric healthcare solutions and technologies within the health sector itself. The Femtech ecosystem at Health Innovation Hub Ireland has the potential to be a great leap forward in support of this work, attracting investment in female-centric health solution research and development. I warmly welcome the contribution the Femtech ecosystem will make to the healthcare system in Ireland. I'm honoured to be a part of today's event, and I would like to congratulate everyone involved in what I genuinely feel is an important and exciting initiative. Gurv Míle Maithugh Galéirigs Gnairo An Talamh.
taking over his speech now. So I think, you know, if you listen to what he says there, he's the Taoiseach and the head of our country, talking about the importance of women's health and how the time is right to do what we're doing now. So I think we are all in this room together. What I'd like you to do before you leave today is at least turn around to the person to the left and the right of you and ask them what their involvement is currently and how they're going to get involved in the future. I'd also like you to join our network. So you'll see little QR codes on the table there. If you scan that on your phone, that will bring you straight into the form where you sign up. We've already got 150 members, including people outside of Ireland who are interested in being involved in investing. But we want everyone in Ireland who's interested in women's health to participate. So once again, in Ireland, we're really fortunate, again, to have the support and an ecosystem that encourages research and innovation and startups. And Enterprise Ireland is one of Europe's the best domestic investor in Europe. And we're delighted that Health Innovation Hub is supported by Enterprise Ireland and also the HSC. And although Leo Clancy couldn't be here with us, he sent us a message from Japan, again, supporting the initiative and what we're doing. So this is Leo, who woke up very early in the morning to give us this.
Hello. I'm very sorry I can't be with you all in person today, and I'm really sorry to miss the launch event, but I'm delighted to have the opportunity to be there virtually and to say thanks and congratulations to everyone involved in the establishment of Femtech at Health Innovation Hub Ireland. This innovation, in addition to an already thriving hub that is Health Innovation Hub, couldn't be coming at a better time. This agenda is extremely important. It's an area of huge opportunity for Ireland, and it's an area we need to be focused on as a society also. I think great things will come of it. I'm very much looking forward to hearing the outcome of the mapping exercise that's going to be undertaken. I know there's going to be great opportunity for networking, and I think we're going to have great innovation days focused on Femtech as well. All those things will not only give us data, information, and a great starting point to build this ecosystem further, they will strengthen the wonderful network that already exists, that came together to put together this initiative and make it happen. And I think the process of going through the work that will follow today is something that will give us a wonderful basis on which to develop this sector further. So thank you for all your work. I look forward to hearing more as time goes along. Have a great day.
Okay, so that's the end of the videos today. The rest are all in person. But what I want to say is a particular thank you to the representatives of our government that are here today from the various departments, Enterprise Ireland, the Department of Health, and Department of Enterprise, Trade and Employment, and the HSC. Health Innovation Hub itself is funded both by the Enterprise Ireland and by the HSC, and we are provided with staff through the HSC who work with us part-time in the hospitals and part-time in our projects. And that's really important. So you'll see a couple of the staff here. You should make yourselves known, guys, because you're really important in helping us deliver the projects we deliver, because you are the ears and eyes on the ground inside in the healthcare system. And I think just to give you some context about how this started, you know, during COVID, we found a lot of companies, not a lot, we had a few companies coming to us with products that addressed women's health. And I'm a biochemist, and I started looking at all this and I was going, wow, there is so much happening and that's so interesting. I mean, one of the things, and John is going to tell me, stop talking about that now, but one of the things was the fact that girls are no longer using regular period products that we would have used when I was growing up. And some of them are using, for environmental reasons, period underwear that absorbs the blood. And that provides a biological sample. That provides so much valuable information that we can use. But what it needs, we're not there yet. What we need is the research, we need the technology, and we need people to work together to realize the potential that's in that sample. So that's just one thing that got me going. I was like intrigued by that. But then I saw how much work is going on in Ireland. And I think it's really important that we just push the agenda and make sure we deliver. So we couldn't do that really, support those companies without the access to clinical experts. And fortunately for us, John Higgins is the lead PI for Health Innovation of Ireland, and we found it quite easy to access that. John has had the foresight to create an innovation lead out in Ireland South. The Women's and Infants Director, so Katrina Heffernan, is there, and you'll hear from her later. And we've been able to work very closely with the team out there to provide access to companies who need feedback, and I think some of the companies here will be able to attest to that. So really, now is the time to get John to come up here, John Higgins, to tell you about how we will engage with the Ireland South Women's and Infants Directorate through Femtech at Health Innovation Hub Ireland. Thanks, John.
Thanks, Tanya. And I must say, I feel I'm not dressed appropriately. I think the instruction was to wear something pink. It's probably one of the few times in the last 3 years I'm in a suit. We have come through, I suppose, 2 or 3 very difficult years. Those of us who work in the hospital system probably expect never to see anything like it again. But necessity brings innovation. And Tanya mentioned the COVID pandemic and its impact on Health Innovation Hub Ireland. It actually opened up for the first time in the healthcare system, in the hospital system certainly, a real sense of what we could do if we were allowed to do it. And the role of Health Innovation Hub Ireland in many respects, there's a practical role, and 400 companies is a huge engagement. But on the ground in health, it has 2 main functions. I wear 2 hats, but today I'm instructed to wear my maternity services hat, and I'm going to tell you a little bit about our directorate. But on the ground, it has 2 real functions. The first is to make it absolutely clear to staff who work in our system that the whole concept of innovation, research, but innovation leading to job creation, which is brand new to anyone in health to think about, is a legitimate thing for those of us who work in the healthcare system to think about and to support and to nurture. And that's really, really important. And the second thing is that if we do that, not only do we help entrepreneurs, help companies, but we get access. We get access to new ideas. We get solutions to problems that we've been unable to fix ourselves. So when Tanya said she wanted to focus on Femtech, I had to point out that CUMH is the single biggest site for projects through Health Innovation of Ireland already, but there's nothing we would want to do than to work with her and the Health Innovation of Ireland team to put a real focus on it and to give us something that, entrepreneurs in this space can then work with, get access to a clinical environment. And then what we want these entrepreneurs to do? We want them to go and make their product and sell it to the whole world and be a success themselves. Now, when you look at that from the context, and I noticed the stats, the 2% and obviously 50% of the population. See, I actually would be completely optimistic. I was thinking about the clinic yesterday I was in. And when you're in a clinic in 2022, patient voice is very powerful, very strong in the debate, in the discussion about anything you do. And when it comes to patients, I believe that women are actually way more discerning in healthcare than their male counterparts, and far, far better at navigating any system they find themselves in. And I just think if we put this opportunity out there for Femtech, we are going to be run over by enthusiasm and engagement. It's a fantastic thing, and I want to particularly say it to Tanya and the whole team, but I just want to say it to Tanya, because it's come out of her head. This is going to be bigger than Texas. It's going to be fantastic, and we're all going to wear pink from now on. and I mean that. I wish I could put it. Our scrubs are cerise in colour. I wish I'd be able to come down in them, but there would be an infection issue if I had. Now, in terms of the future in Ireland, though, and in terms of the services we provide to women, I think it's really important to acknowledge the task force. We're going to hear about that now in the next speaker. But I think the current minister has put a real focus on women's health, and I think he really deserves credit for that. And I want to say thank you to him and to the whole Department of Health for that emphasis. So we're sailing downwind in picking this topic, and I think we just got to use every opportunity that we can. Why the Ireland South Women and Infants Directorate? Just to give you some background to that, we look after about 1 in 5 of the population. So 1 in 5 of all babies born in Ireland are born within our directorate. So that's a big enough platform, and it really gives you the kind of service of scope and scale that will help almost any entrepreneur with an idea to get access to something relevant to them. And in 2023, we're going to roll out leads in all the key areas. Many of them are things that we've been focusing on for a long time: general gynecology, infertility. We're going to have a big new centre for fertility here soon. But the one I think I would mention that's going to come into focus in the next while is a big one coming back, and that's menopause. And I think the older woman, whatever about maternity services, the older woman, I think, has been neglected, and certainly between 50 and, let's say, 65, that age group in women's healthcare. If you're an entrepreneur and you want to look for ideas and a place where there's a gap, big gap there, and I'm delighted that the menopause is getting the focus and the investment from the Department of Health. And obviously, Enterprise, the Enterprise Department and Enterprise Ireland are also hugely important. And Tanya mentioned the HSE, who fund us directly with staff. So in our directorate, over the last 5 years, we have a clinically led directorate, and as clinical director, I hold the budget, and that's unique in the HSE. But the big focus for us has been on our waiting list. And Tanya asked me to give an example of how we would bring in someone with an idea. So we had the biggest waiting list for gynecology in the country. 17% of the entire women waiting for care, gynecology care in Ireland, were on CUMH's waiting list. And we have tackled that with every kind of innovative, pragmatic, flexible method we could think of. But just to give you an example of one of the ways directly Health Innovation Hub Ireland would have helped us. We had a huge problem with patients not turning up. So waiting for 2 or 3 years, 1 in 5, 20% DNA rate. And that's a tremendous resource waste. So we spoke to Health Innovation Hub Ireland. They had a company who had a product where the patient self-chose the time and date. 500 women got a letter in the post, and it said, log on here and pick the time and date that suits you. So 2/3 of those logged on out of working hours. So first of all, it's convenient for people. And secondly, when they chose that date, 2% was the DNA rate. So a wonderful example of something you can do. I mean, we couldn't have accessed that ourselves. There's nobody in the HSE was offering us that, but Health Innovation Hub Ireland was offering that opportunity. So what I would really want to emphasize today is that we have loads of problems, loads of issues, loads of areas that have been either neglected or we tried to solve them, but we can't. And I just know we've got to look outside. Health has got to look out beyond itself. And there are entrepreneurs out there with solutions that will really impact on the healthcare system with specific regard to women. So I'm entirely optimistic, and I'm absolutely certain that the women themselves are unbelievable advocates. As I said to Tanya, men regress to the teenage years when they come into the hospital. They answer in monosyllables, yes or no. But women look at what's in front of them. They navigate the system. And what we want to do is make that even easier for them and to tap in to their expertise, their experiences. And I think we're going to hear some of that in the next speaker. So a big thank you from me to all that have put this meeting together. Congratulations again to Tanya and the team. My role in HIHI is generally just to do the talking, and others actually do the doing. So congratulations to all. Fantastic.
Thanks very much, John. So you mentioned that we would hear next from the Women's Health Task Force, and I think it's really important that you listen to what has come out of this. They listened and they recorded and reported, and from that came an action plan. But I think the contents of this really provide us with an agenda to look at for development of future products and services in Ireland. So I'm delighted to invite Aoife Gillivan to the stage here to give you sort of a snapshot of what came out of that. Aoife is Assistant Principal in the Department of Health and also representing the Women's Health Task Force today. So thank you, Aoife.
Hi, everyone. Thank you. Thank you, Professor John Cryan, Professor John Higgins, and Dr. Tanya Mulcahy, of course, and the entire Femtech team and the team behind Health Innovation Hub Ireland for hosting this event. I can tell you it is a very exciting event for all of us on the task force to see things in motion outside of our bubble. So thanks very much. My name is Aoife Gillivan. I'm the Programme Manager for the Women's Health Programme in the Department of Health. And I'm also representing the Women's Health Task Force today, and our co-chairs of the task force, the Chief Nursing Officer, Rachel Kenna, and Director of the European Institute of Women's Health, Peggy Maguire. The Femtech initiative is a very, very exciting space for the task force. There is so much opportunity for innovation and disruptive technologies to revolutionise women's health and ultimately achieve the goal, our shared goal, of improving the outcomes and experiences for women, not only in Ireland, but globally. The Women's Health Task Force is a demonstration of just how valuable partnership and collaboration and a sustained commitment on women's health can be. The task force was established in September 2019 by the Department of Health to improve women's health outcomes and experiences of healthcare, and it followed a recommendation from the scoping inquiry into the cervical check screening programme that women's health issues be given consistent, expert and committed attention. The task force has modelled open policy making, working in a collaborative way involving policymakers, clinicians, international partners, advocates, health experts, and the voices of women through workshops, research and outreach. Listening to women is at the core of our work in the Women's Health Programme. The task force has listened and engaged with more than 2,000 individuals and organisations representing women across the country. What women have told us has become the foundations of the Women's Health Action Plan. This is my very tattered version of it, but I would encourage all of you either to download it digitally or I'll happily post it to you if you email me directly. It's a great pathway for you if you're working in innovation in this space to give you a guide on what women told us and the priorities that they listed as we kick this off. The action plan itself commits to 10 key actions that responds to the areas of women that women have asked us to prioritise. They include gynecological health, menopause care, endometriosis, a life course approach to health, contraception, postnatal care, developing an evidence base for women's health, a very neglected space as we've come to learn, improving experiences of services, access and literacy supports. The plan is extensive. I would like, though, to use this time today to share with you the feedback that women have given us, the task force, over the years. Women have shared what they experienced, both good and bad, and within their health service, what they would like to see change and where they need to see improvements rapidly. And hopefully this will give you all food for thought in your capacity as innovators. So a broad range of listening exercises were conducted since 2019, workshops, webinars, in-person testimonies, public consultations, and a radical listening exercise was carried out over 2020 and 2021. And today I'll share the results of that radical listening exercise with you. It was led by independent researchers. Women across the country participated in these discussions. So starting with the positives, they told us that it's not all bad, thank God. Factors that shape positive experiences for women have included listening and empathy that they experienced in maternity care, open and trusted relationships with their general practitioners in primary care, effective communication in acute care, direct, informative information, and access to tailored female-centric services in their screening programs. The negatives: generally, women reported of the overall healthcare system, feeling unsupported, feeling ashamed and embarrassed with limited information available. They feel rushed, unheard, and that their voice doesn't matter. They feel the weight of the responsibility of caring. Often women are the primary carers within the household. They identified a lack of communication, effectiveness, joined up thinking coming from their health service. Marginalised groups in particular feel they are treated unfairly, lacking dignity, not provided adequate resources to manage their own life course journeys, taking into account often language barriers and health literacy. Again, generally, information and communication was a key theme across all of these groups. women asked us for access to accurate and trusted information on women's health that will guide and support them through life stages, reflecting really what Professor Higgins had mentioned of women knowing and wanting to interrogate their health system and navigate their own journey. So I'm going to break it down into age cohorts just to give you more targeted information on where maybe you might innovate and disrupt. Starting with women aged 26 to 35 years old. They told us that COVID-19 has brought a new focus to their health and well-being. This is an opportunity for us in preventative healthcare. This group are now thinking about their life course overall, like never before, from nutrition to physical activity and mental resilience. But at the moment, health information feels overwhelming to this group. There is too much noise, too much volume, and it is adding to confusion and frustration. So what have they asked us for? Tailored, relevant information that prepares and equips women, online resources with practical information on general health and well-being, skills-based community learning and education during pregnancy and after having a baby, online resources with practical and realistic information that prepares women for the realities of motherhood, basic facts about mental health. Some purported a mental health app, creating a forum to share and speak to others and have more intimate conversations with dedicated support. So overall in this age group, themes of information and maternity supports are their priorities at the moment. On to the 36 to 46-year-olds. Managing personal healthcare needs along with the needs of others becomes increasingly difficult for women in this age cohort. Time, energy, and financial resources are stretched for this group. Anxiety, worry, and stress are consistently present in the background of their lives. The role of mother or carer places a burden of responsibility on women who are afraid what might happen if they themselves get sick. Weight management is difficult, and finding motivation to stay active or eat well can be draining. Anecdotally, we've heard from our partners in the National Women and Infants Programme in the HSE, they've interpreted a lack of permission to focus on yourself in this age cohort with all of the other priorities and demands on them. So what has this group asked us for? Reduced waiting times, improved access to services and appropriate care. They want to see joined-up thinking in relation to all of their services. Improved communication, a regular theme, where they are treated as experts by experience and informed of the steps in their health journey. Then moving on to the 40 to 60-year-old women. Facing into menopause can be a daunting experience for women. We heard that women felt isolated, unsupported in the health journey. Menopause was a taboo subject, not discussed on mainstream media, their peer groups, their workplace. This was 2020, 2021, how quickly we might have changed that. Women felt unsupported by society and some were at a very low point. They no longer felt valued by society or by the healthcare system once they ceased the physical ability to have children. They reported feeling dismissed, their symptoms not taken seriously. They shared their symptoms with us, often debilitating, hot flushes, brain fog, fatigue, joint pains, to name a few. This is a great example of how listening to women, taking on their feedback and responding directly can achieve immediate and powerful results. The Women's Health Action Plan, Action 4B precisely, off the back of what women shared with us here, committed to changing the approach to menopause care and increasing public supports available to women before, during and after menopause. You hopefully were exposed to the Menopause Awareness Campaign recently, a print and radio advert, and the launch of a new information resource, gov.ie/menopause. The department's Menopause Awareness Week got us all talking, hopefully, about menopause, on radio, in newspapers, on TV, social media, in offices, around the dinner table, taxis, shops. We all learned and became informed and unafraid to discuss. And women, especially women in menopause, now felt seen, felt supported, and no longer hopefully felt so isolated. What else did women in the 46 to 60 category tell us beyond menopause? Bladder and pelvic floor issues, the lack of information and practical advice to prevent these common issues. And they don't see best practices evolving in women's health, again, wanting to be involved in that pathway, understanding how it flowed. So what have they asked us to do? They wanted us to tackle the taboo of menopause, and education and information, a big priority for this group, a life course approach to learning about health and well-being beginning at school, not when you're 60. And then bringing into the women in their 60 and 60 plus category. They see healthcare and women's health through the lens of the changes they've seen. A closed off Irish society meant they were silent, and this group feel the weight of the legacy of silence. They feel they do not have the language or the confidence to interact and engage with healthcare professionals. They don't debate, they don't question. They report a sense of passiveness when it comes to their healthcare needs. They told us their priorities are staying active, well and independent, a major priority for this group. Community healthcare and education on prevention, upskilling on technology to stay connected, all priorities for the category of 60 plus. The women who took part in the radical listening exercises had many ideas on how we might improve and disrupt the services. And I encourage you to look over the slides that we have on the radical listening. It's on the website. And again, I'll happily email it around if you'd like to read more into what they gave us, and they might spark a few ideas. So where can we start to help and disrupt and to improve? For the department throughout 2021 and 2022, there have been a number of innovations and interventions to improve women's health, and it could not have been done without the partnership of the HSE, NWIP, our clinicians, our hospital groups. It's been a collective effort. We are delivering 6 specialist menopause clinics nationally to treat complex symptoms of menopause, 2 super-regional endometriosis specialist centres for complex care in Tala University Hospital and Cork University Maternity Hospital. In addition, the Women's Health Fund has invested in 6 interdisciplinary teams to support holistic treatment of endometriosis in each of the hospital networks. Elimination of VAT on HRT and period products, delivery of free contraception to women aged 17 to 25, targeted supports in mental health, including digital services, perinatal mental health, specialist eating disorder supports, and mental health supports for marginalised groups. A network of see and treat ambulatory gynaecology clinics. 12 are currently open out of a network of 20, and it is estimated that 70% of general gynaecology referrals can be seen at this one-stop setting. 0.7 million funding in period poverty initiatives across 26 local authorities. And it's continuing, this focus on women's health. Budget 2023 saw an allocation of 69.2 million in women's health, 10 million to provide access to publicly funded IVF, an expansion of the free contraception scheme to cover 16 to 30-year-olds, and just to highlight how quickly that scheme has been delivered and now is expanding, the momentum and drive of government behind this initiative. 0.9 million investment in the development of the women's health hubs for holistic life course care. In 2023, the Women's Health Task Force is going to continue to listen to women and monitor the further implementation of the action plan. We've got 5 key actions we're focusing on. Action 5, improving women's experiences of health services, so targeting culture, information, access for marginalised women. Action 6, to grow the evidence base for women's health by supporting clinical, academic, applied research. We're here to support that. Action 7, reimagine how care can be delivered to women through innovation and new approaches. This work to improve the outcomes for women's health in this country, as I said, relies on partnership. And here in this room, in this space of women's health, there is ample opportunity, plenty of areas to innovate and to disrupt, to create technology that will improve outcomes and experiences for women. And I hope that the voices of the women shared today can inspire you as it did the task force. And the task force, the Women's Health Task Force, is here and available to all of you to share evidence, insights, and support you in our shared efforts. Thank you very much.
Thank you, Aoife. That was really fantastic, because I think, when I first listened to you and the outcomes of it, I feel a bit sad sometimes when you hear the voices of women and how they feel. It's actually sad that 50% of the population aren't like that. But actually, I'm also buoyed up by the fact that you've actually done something about it, and there are already activities that are really impacting women, so that's fantastic. And I think, as you say, this room is full of people that are supporting, and I want us all to work together to make sure that 5 years from now, when you come back and you talk about the results of listening to women, that they are all really happy, really supported, and really healthy. So thanks a million for that. So we move on to the next part of the presentation today, which will be the panels. But before we do that, I just want to give you a little bit of flavour of what we're going to deliver over 2023 in terms of Femtech at Health Innovation Hub Ireland. So again, we're going to expand our network. So today you've all signed up because my phone has been pinging there with all the new members, so that's great. I'm sure we're up to 200 at this point. But I want you to reach out to everybody you engage with on a daily basis, whether they're just your mothers, your sisters, your daughters, they can all be part of this. And I think it's very important for us to remember that the new generation, the younger generation, will see their health differently than the way we see it. So we need to involve them now in how we develop new products and research. So please do that. Get your daughters, I have 3 sons, their girlfriends, etc., involved in this because I think it's very important. And I was really excited to see there's a student group within UCC in the School of Medicine and Health, and they are actually having their own event coming up next Saturday, I think it is. Someone here from that group, because I know they're invited. So it's brilliant to see you guys involved, and we want to stay involved with you guys to make sure that the students who are learning and will be the caregivers and the clinicians of the future really take on this agenda and support it. So it's brilliant to see that you guys are doing that too, so that's great. So just in terms of our network, we want to grow that. We are conducting a mapping exercise, and you'll see there is a very small version of what we've currently done, which is mapping all the, really the startups in Ireland that are working in the Femtech space. So we want to keep adding to that. We want to support them, and as John said, we want those companies to go out, take on the world, be successful, employ our graduates, and help the women of Ireland. So there's, it's a really good agenda, and I don't think we can argue against it. We will do the same for the research community. So we will go out to the universities and academic institutions and map what's going on there as well. And then we want to map the large multinationals that exist in Ireland that have an interest in women's health, because I think they need to be part of the story too. And we'd like anybody who'd like to be involved in that to get in touch with us, because going out and mapping sounds very easy, but we have to talk to a lot of people to do that. Working with the Women's Health Task Force and the members of our network, we really are going to try and understand priority needs areas that we can work on and develop new solutions for. So I'm really looking forward to working with you guys in the Department of Health on that. And as John said, we're going to identify clinical leads who will actually take the lead on different areas of women's health. So anywhere from general gynecology all the way up to osteoporosis and bone health. And we plan to do a series of Femtech gatherings, a little bit like this, but actually more networking. So less speaking up here, more you guys speaking to each other, because I think when you get people in a room together with the same agenda, fantastic things can happen. So there will be food and wine at it. You can have coffee too, but we want to have a series of those events across the country, and we want to really kind of spotlight the Femtech initiative through them. And what I'm really excited about is our Rapid Innovation Days. And sorry for the pun, but they're called Fridays, Femtech Rapid Innovation Days. And what we plan to do is go out and ask people to participate in this. We want multidisciplinary teams. We will have our clinical leads identifying a problem. And over the series of 6 to 8 weeks, 2 hours on a Friday, we want those people to be given leave to go out of their day-to-day activities, participate in these Rapid Innovation Days, and come up with a prototype so that we can then move along to develop that and implement that. So hopefully there'll be some fantastic ideas coming out of that, and if you're interested in that, we will communicate through the network listing. So I'm going to stop talking. Today is the first of many new events that will happen in the future. I'm now going to hand over to the panels. So we've got 3 different panels today. We will start with the research panel, and I'm delighted to welcome Dr. Sally Cudmore. And as John Crine said, the first female head of UCC Innovation, so I'm delighted to congratulate you on that, Sally, but also to say thank you for the support you've given to this initiative. Through UCC Innovation and the team in UCC, we'll be able to access research supports and also the commercialization supports through that office there. So Sally, if you'd like to come up and chair the panel, and I'd ask the panelists then to come up as well. So your names are on the screen there. If you could take a seat up here on the white stools. This is your chance now, guys.
Great. Tanya, thank you very, very much. And as the panel assembles up here, I just want to start off by saying a couple of words. And the first thing that I want to say is there is a revolution happening out there. up until maybe a couple of years ago, it was a relatively quiet revolution, but women are really starting to speak up now. We're hearing it in all sorts of media. It is no longer taboo to mention period, to mention menopause, to mention mental health around women's health. And I think it's really, really important that we jump on all of the opportunities that this greater discussion in the ecosystem is providing all of us. So really what this next session is about giving some examples about the excellent research that's going on in the general space of Femtech. UCC Innovation and similar innovation offices in the other universities provide supports to researchers. What we are all about is trying to help get that excellent research that's happening on the ground out there into the community. We want to drive this research into something that's going to make a difference. And in this particular case, we wanted to make a difference to women's lives, to their health, but also not only, I mean, women are predominantly the main caregivers in a family situation. They're the ones who are making the health decisions for their families. So if we can ensure a healthy female population, a population that's very familiar and willing to talk about health issues, it is going to benefit the overall population. So John has already outlined, I suppose, the various supports that are available specifically in UCC Innovation. I will repeat some of those. We have an excellent team of commercialization specialists who help the researchers to identify any potential intellectual property, to protect that maybe through patenting, through trademark, whatever it might be, and then to put in place processes to actually help to commercialize that. Ideally trying to spin that out into new products, into new services, and ultimately with an aim to actually generate new companies that will help to promote these products, but will also then start to create jobs in the system. So at the end of the day, this is about trying to make Cork, put Cork on the map for Femtech, put Ireland on the map for Femtech. This revolution is happening internationally. The amount of investment that's going into Femtech, for example, it's estimated that there'll be about $50 billion spent in Femtech by 2025. That's only about another 2 or 3 years. So the opportunity is ripe. It's up to all of us who are here today to come together, to help each other, to create that network, to create that enthusiasm, that ambition, to be brave, to step outside of our comfort zone, because we collectively can do this. So you've heard enough from me now. What I'm going to do is jump to the really great group of female researchers and entrepreneurs, because they're all interested in taking their research to the next level. We have about 15 minutes, so each of them is going to introduce themselves first, and then hopefully we might have a little bit of an opportunity at the end for some discussions. So what I'm going to do is I'm going to ask them in turn to maybe introduce themselves, talk a small bit about their research and where they're trying to take that to, I suppose, what the next step on their journeys are for them. So what we might do is we will start off, I suppose, in the list that I've got it here. So maybe, Siobhan, if you don't mind, we might jump to you first, Siobhan.
Absolutely.
You might tell us a little bit. Yeah.
Thank you. So good afternoon, everybody. My name is Dr. Siobhan O'Mahony. A senior lecturer here and also principal investigator in University College Cork. So it's fabulous to be here seeing so much pink. Sorry, I'm not wearing pink. Didn't get the memo. So I suppose in the context of women's health, my research is really focused around innovative, kind of sex-specific interventions to improve women's gut, but also vaginal health as well. So particularly, I suppose, our one focus of mine is trying to reduce the burden of stress during pregnancy and optimise maternal health in order to improve outcomes then for mom and baby, really. So another area that I research is a female-specific disorder, which is endometriosis. So at the moment, I'm investigating diet and the gut microbiome with regard to this disorder. Then again, trying to develop an intervention to reduce pain flares in this very common but also very debilitating disorder. So I'm on a journey at the moment with Enterprise Ireland. I have my feasibility award and hoping then to apply for a commercialisation fund next year. But what I want to say today is thank you so much to Tanya, thank you so much to Sally and everybody in the room. I'm extremely excited to be part of Femtech at Health Innovation Hub Ireland. The services and the resources and support are amazing, from access to clinicians to access to business consultants to helping with support eventually with pilot studies and clinical validation studies. So without these, I would not be able to bring my research into the commercial world. So I want to say thank you, and I'm really looking forward to the future with you. Thanks.
So next we're going to jump to Siobhan Kelleher. maybe tell us a little bit about you and your journey as well, Siobhan.
Thank you. My name is Dr. Siobhan Kelleher, and I'm based in NUI Galway. And I've spent the last 5 years developing a novel digital biomarker for chronic endocrine conditions. And I too am looking at endometriosis as my first application. Currently, I suppose in this audience you're all quite aware that it takes on average 7 years and 7 different GP visits to get a referral for a diagnosis for endometriosis, and that's because surgery is the gold standard. What we're trying to do and what we aim to do is develop a wearable device which will reduce that time from 7 years and 7 different GP visits down to just 3 months and 1 GP visit. So I guess my story is slightly different. Although I have a science background, I spent many years in industry, and I did a MedTech innovation program called BioInnovate, and I'm one of many alumni here today as a result of that Enterprise Ireland sponsored program. I've been very fortunate to get funding from Science Foundation Ireland, Enterprise Ireland, the ERC and EIT Health to do an awful lot of research in terms of preclinical studies and volunteer studies. I've spent a lot of the last 5 years working very closely with women in terms of designing this device and how it should be used and how we introduce it. I will be spinning out a company next year to further develop device. So that's
Great, thank you. Super, and back down closer to this part of the country, to Joanna.
Hi everybody, I'm Dr. Joanna Tierney. I'm based in MTU Kerry. Thanks very much, Tanya, for the lovely invite today. So I suppose my background in terms of research, I lecture as well in a lot of the bioscience programs there in MTU Kerry. But in terms of research, inflammation is kind of the common theme through my research, and I'm based as well in Enterprise Ireland funded Gateway there in Kerry, the Shannon Applied Biotechnology Centre. We deal an awful lot with companies. We're at the kind of forefront there, interfacing with companies that come to us looking for the science behind the ingredients or the technologies that they have in the marketplace. So we did some work there with Revive Active. We were the science development there behind Minnow Active, which is a leading supplement there that's on the marketplace at the moment. So that there is science behind the ingredients in that product. We also we have done work as well there with a new mum, postpartum health company that deals with looking for, I suppose, anti-inflammatory and wound healing properties in their medicinal cream for vaginal trauma that's induced in the vaginal tissue. So we've done a bit of work there, and their product there that's on the market as well. We delved a lot into the science, the biological activities behind the ingredients in those products that are delivering effects at the cell level. We're also working with, so I do a little bit of work with Tyndall. There's a group there in Tyndall that have this lovely sensing technology, laser-scribed graphene electrodes, and we have demonstrated how we can pick up a clinical chemistry marker, interleukin-6, which is not available at the moment in the clinical chemistry analyzers. I used to work in clinical chemistry development as well in industry, but we were looking at I suppose with women's healthcare, the perimenopause, menopause, because I'm sure you might be familiar with this fact, by 2025 there's going to be over 1 billion women worldwide experiencing perimenopause, that transition into menopause. And we were looking to develop a wearable, non-invasive sensor that could help women track their own journey, kind of, especially the role of nutrition in that journey, because no offense to GPs, but just from experience of talking to family, friends, when you go to the GP, experiencing over 64 symptoms there of menopause, the answer hasn't been very helpful based on, maybe you're a bit too stressed, you're a bit too young, and so forth. So we want women to take control of that journey by developing this sensor. We, as I said, doing work there with Tyndall, looking for hormone markers and nutritional markers there that can help help that journey. So as I said, the technology is there. We just need to kind of, I suppose, maybe make it a little bit more complex in terms of looking at multiple parameters there, but just to give women charge of that journey themselves for preventative healthcare, because again, with the research that we've done around menopause was an eye-opener for me. The long-term health problems there with osteoporosis, cardiovascular disease, dementia, it's kind of eye-opening, and women are very smart. They're very we are very tech savvy as well, and as I said, we're very excited to be in this area, really just, as I said, to help women take control of that journey. Super.
And we're bringing it back to UCC, and so Kelly.
Yeah, hi. Thanks, Tanya, and the team for the invitation to be part of this panel. I'm a lecturer and a principal investigator in the School of Biochemistry and Cell Biology here at UCC. I am a biochemist also by training, and an RNA biologist. And what my lab is trying to do is to discover a new class of RNA molecules that could be used for early stage diagnostic markers in ovarian cancer, but also maybe for prognostic indicators as well. So I'm here today with one of my amazing PhD students, A.D. McCabe, who's done phenomenal work on this already. And the other project we work on is early stage breast cancer, again using RNA molecules as indicators. And for that, it's really focused on ductal carcinoma in situ, which is stage 0 breast cancer. And what we're trying to do is identify molecules, RNA molecules, that will allow clinicians to stratify patients so that there is better treatment. Because currently women diagnosed with DCIS, some of it will advance to invasive carcinoma and some of it won't. And there's no way of knowing which patients will advance and which ones won't. This project in my lab is very much based on my own experience as a patient, and that's why we work on it. So I'm super excited to be here. I remember Tanya mentioning this to me in the hall, like on the stairs in Western Gateway, and I was running around and she was going somewhere else, and she's like, Femtech, what do you think? And I'm like, we're in, yeah, just tell me when. So I'm so excited to be here. Do talk to us. We don't have a company yet. We're really at preclinical stage, but I'm really interested in talking to people that might move us toward a liquid biopsy, which is kind of where we're headed. All right, thanks.
We okay? Time for a couple of questions? Yeah, grand. So I suppose, we've heard statistics today that, there's about 2% of investment in R&D is going into, we'll say, research in this space. But I suppose what I've seen with my previous more research hat on, a shift over the last 5 years in particular, which are now looking for, there's a greater expectation that we address gender issues in our research. And I'm just wondering, are you seeing this now as well? Is this a shift that's really, there's a clear focus on this? I don't know if one of you would like to address that.
Yeah, I think all funders really want us to look at both genders. So now it's a little
Sure.
bit...
Yeah.
So, which is fantastic, because a lot of our research, preclinically and clinical research, would have focused on males. And personally, from a preclinical point of view for animal research, we use males because it was easier. We didn't have the cyclical element of the Easter cycle in our rat studies. But even funders for animal research say now you have to use males and females, which is fantastic, but sometimes it's not translational to the human situation or syndrome. But then, of course, in clinical studies as well, of course, we do need to use males and females, but we are extremely different. Female research and female anatomy and female gut microbiome is extremely different to the males. So whilst we do have to look at both genders in the human population, we do have to have gender-specific and sex-specific research as well. And now the time is really for women-specific research. I'm not saying leave the men behind, but I'm just saying there's very focused need for women-specific research nowadays.
Great. Okay, thank you. Siobhan, I might jump to you specifically with a different sort of question. We heard John Higgins on the one hand talk about the fact that there's so many needs out there in the clinics. And I suppose what we're all talking about here from a slightly different perspective is this is sort of the research that we're doing. So how do we ensure that this kind of needs-led matches, I suppose, the research and the innovations that are coming out of the university. And I know you've come through the BioInnovates programme, which is very much driven by trying to identify the problem. So we've got both going on, and it's essential that both are going on. How do we best get them meet?
I think it's by continuing the conversation. So I suppose when we go out and look at problems, you know, we're talking to end users. We're talking to people who work in the clinics. We're talking to women who have to deal with their daughters who can't go to school. You know, it's that we have those conversations, and it's ensuring that those conversations are not just there to identify the problem, but they continue so that we co-develop and co-design the solution. So I think that's where it's not just a distinct part of the journey, that some of these stakeholder relationships, and especially the end users, those women, that we continue that conversation and we tell them the good parts of the journey and the bad parts, because they're able to help us. You know, for me, I thought I was finished during COVID because we were asked to leave the university and I'd finished my study. And I went back to my patient advisory panel and I said, do you think, is there any chance, even though we're watching, you know, during their first lockdown, what was happening in Italy, that if I send a device home to women, that they will take the data and send it back to me? And these are women in pain who were trying to work at home and manage children, you know, homeschool. So they're so eager. Like, women really are looking for opportunities to be part of the research and to be part of the solutions. So I think it's just bringing everybody along. I don't know if that answers it, Sarah.
Great, thank you. Joanna, what can this Femtech network, do you think, do to help you and to help other researchers to inform their research and to bring it on to the next level? How can we as that ecosystem really promote this?
Well, it's interesting. I mean, I'm a grant reviewer on some international funding schemes, and impact is massive. You know, it's always kind of well up there in terms of how is your, you know, it's grand to be doing research and the excellence, but impact really is a big focus. And something like this Femtech initiative, the impact and that it's reaching, that, you know, the audience of funders to the end users, women, is so important. And it's interesting actually with some of the kind of female healthcare projects that we've tried to get funded in the past. I think they need to even look at some of the reviewers in these grant systems, because there's a little bit of gender feedback coming in that's sometimes not appreciated. That's something I think that could be looked at as well, for a variety of different reasons and a variety of different funding schemes. So I suppose just to kind of get the bigger picture there, but I think an initiative like this is just amazing for impact, and it's just something that's just so important from that perspective.
I see Tanya standing up, so I think that's our signal to get off the stage. So look, just want to finish up by saying to everybody, we have a brilliant opportunity here. I suppose I'm a daughter, I'm a mother, I'm a woman of menopausal age, my daughter is going into nursing. You know, there's so much happening in the ecosystem that affects each one of us as individuals, and this has been really wonderful, and it's been an inspirational session so far with all of you. We can see what's coming down the track. We need lots more of you. To the men that are in the room, you're brave being here amongst a big bunch of women, but we need you too. So thank you. Thank you for coming along today, and I look forward to hearing much more from everybody. Thanks, Tanya.
Thank you, guys. I think we're going to mic you and move on to the next ones. But I suppose just Claire, if you could come up and maybe the panelists for the industry panel, and just while you're getting ready there, I think the one message I got from that, and I think it was when Kelly was saying, I'm doing the research, but I need you guys to help me bring that into a product or out into the community. So what I really want from this Femtech ecosystem is that you'll all talk to each other, whether you're a researcher, whether you're already in industry and might be looking for your next product. Just make those conversations happen. So while they're all getting mic'd up, I would like to introduce Dr. Claire Walsh. Claire has been involved in the Health Innovation Hub for a long time, and I know Noel is down there, he's been there previously, so there's quite a few people who are intimately involved with Health Innovation Hub Ireland. And I suppose that you'll probably be able to see that what we do day to day on the ground is help companies. And one of the big things we do, which was talked about there, is that clinical access and end user feedback. And we can bring people to you guys if you want to test out your idea, your pre-commercial prototype, or your finished product. Something that's not easy done, actually. You can't get into the hospitals, you can't get access to the patients, and we were able to do that. So make sure you reach out to us if you're at that stage. Claire, I'm going to get you to take over now, if that's okay with you, and introduce our really exciting industry panel, because you'll get to see some products that are being developed or already developed, and they're all Irish products. So thank you.
Good afternoon, everybody. Just want to say my name is Claire Walsh. I work with Enterprise Ireland in our High Potential Startup Unit, but I've also, in my previous role, worked with Sally and the team in UCC as part of our Commercialisation Fund programme. So a lot of the faces today are familiar to me, but I suppose I would like to give a sincere thanks to Tanya and the job that she has done in pulling this event together. Enterprise Ireland, well, I guess, like Tanya said, we've been involved in Enterprise or in the Health Innovation Hub since the beginning. It's been going, I'd say, almost 10 years now, all in. And the Health Innovation Hub is a very special programme within Enterprise Ireland. It comes from a very unique collaboration between and probably the first collaboration between the Department of Health and Department of Enterprise, Trade and Employment. So it's great to see our government colleagues in the room today as well. But in particular, as with, I think Enterprise Ireland has been name dropped a lot this evening or this afternoon, but we never do anything in isolation, and it's really the collaborations from agencies, programmes, universities across the entire ecosystem that allows us to have this kind of impact. So what I think is great today, it was so wonderful to hear from Aoife and the Women's Health Task Force, because I think every piece of feedback that you gave, I think, is represented on the industry panel here today. So I guess you guys will introduce yourselves, but it's Barry, Derval, Danny, Paula and Heidi, who have touched Enterprise Ireland's supports in some respect, I suppose. At Enterprise Ireland, we do a lot of different things. As it was referenced today, you've heard about the Commercialisation Fund programme that some of the research panel have availed of. We have supported the BioInnovate programme. Our startup unit, we have a framework of supports that really brings companies from very early stage all the way through to our ultimate mandate, which is to scale and compete in global markets. So I think one of the most important things is, whilst we offer quite high touch kind of one-on-one supports to companies, it really is the value of the ecosystem that can really shift gears for companies. And I think what Tanya has managed to do today is really provide a focal point for all of the wonderful work that's happening in Femtech and in women's health. We often have a bird's eye view of the ecosystem and of our companies within our startup unit, within our research projects, and within our more accelerated companies. But we never really have a place to come to bring them all together. And I think there's a real opportunity here to harness the power of all this knowledge and expertise in the room and really make a difference for patients and for clinicians who are working with these patients. One of the best things about the Health Innovation Hub and why we funded it, I suppose, was to bring that patient voice through to industry. And I think, as you guys can probably attest to, it is that critical voice of the patient, voice of the end user, that will be the game changer for bringing your products to market. So anyway, with no further hesitation, I'm going to just ask our panel here to just maybe tell us a little bit about yourselves, your product, the difference that it makes for women, and the impact that you think ecosystem like the Femtech can help you. So Barry, I might start down the end with you, if that's okay.
Sure,
if you would like to start.
Yeah, thank you. Delighted to be here today. And before I forget it, I am going to mention that we are supported by Enterprise Ireland, and we really do appreciate them being an early part of our journey, because there's no doubt it is challenging. And I know that Seth Duffy, our DA, is in the room, and again, just being a huge help and support, so thank you. I'm going to actually kind of pivot very quickly at the start, just because I know that we're launching Femtech today, but we've developed out of the BioInnovate program, like some of the other companies here. That was 5 years ago, and in September of 2017, John Higgins opened the doors of CUMH for 4 BioInnovate fellows to go and look at unmet needs in obstetrics and gynecology. And we spent about 5 weeks in his hospital given full access to really identify these problems. So it's been launched today, but many of the people John and his team have been paving the way a long time to enable activities in women's health. And of the 4 fellows that kind of went down 5 years ago, all of us have either started or in Femtech startups today. So it does make a big difference. Very briefly about neurosurgical. The reason we exist is because there are approximately 300,000 maternal deaths every year around the world. Majority of those are preventable. So that's about 800 preventable maternal deaths a day. We aim to change that, and we're starting by making C-sections a safer surgery. We're starting with C-sections because it has become the most common major surgery in the world, and it's currently accounting for about 29 or 30 million births every year. So although a C-section can be a life-saving procedure, it does bring added risk of hemorrhage, infection, and even death, as opposed to a vaginal birth. When you add in the growing rates of obesity, that has a serious knock-on effect and raises the complication rates. So working alongside obstetricians, many of them at CUMH, we have developed the first single-use and self-retaining surgical retractor that's specifically designed for C-sections and that also caters for those challenges of high BMI patients. So basically, we have a very simple, well-designed and patented device with the aim of providing safer, faster and easier retraction. We're currently raising a round that will bring the device to market in hopefully about 18 months and really excited to see what's going to happen of Femtech in the future and delighted to be part of it. So thank you very much.
Thanks, Barry. And Derval, do you want to tell us a little bit about Friendo?
Yeah, happy to, and really delighted to be here and very excited about what's happening. When Tanya and I spoke last week, I think there's lots happening. I just think we all have to shout about it a little bit more. I think that's what's coming through today. So I developed Friendo, which is a digital health solution, went to market about nearly a year ago. It's nearly an anniversary now. So it is an endometriosis digital health solution that screens for endometriosis. It is an endo-specific pain and cycle tracker, along with a community and a health profile. I basically designed what I wish I had a long time ago. I went for 18 years without a diagnosis and being misdiagnosed along the way. And I decided that I really wanted to kind of get back to grassroots levels and offer schoolgirls in particular and university students something where they could get validation and somewhere to go to where they can get credible resources and be able to certainly not diagnose but screen for it and then track the disease on an ongoing basis. So that's really the objective. Our mission is to screen schoolgirls, and our long-term mission is to become a clinical trials partner with pharmaceutical companies and CRO, and really produce real-world data to create better treatment pathways. I think, I see so much that we can all do together with the amazing work that Siobhan is doing down there, and it really is about, I see data being the power, really, and we have nearly 5,000 subscribed users already and engaged users. I did 2 school talks this morning. I'm seeing engaged schoolgirls who want to learn more. They're a different kind of caliber to the schoolgirl I was, I'll tell you that much. They ask much more pointed questions. So they want to know. And the other thing is GPs want to know. Medical professionals, they want to be armed with the knowledge. They want referral pathways. They want tools to be able to offer their patients during that diagnosis delay. So we want to be able to offer them that. And we're hoping to be able to do it. So thank you so much for the opportunity. I'm really excited to be part of this.
Thanks, Derval. And we're just going to work our way up the line. So Danny, if you don't mind.
Thanks very much, Claire. And I should echo what Barry has said in thanking Enterprise Ireland for their support throughout the Atlantic Therapeutics journey as well. It's fantastic to be here today. I think as Derval alluded to, it feels like there's lots of different threads of activity happening. I think the work that Tanya and the Health Innovation Hub and weaving all of those threads together is giving us a very powerful network, and I'm very excited to see where it takes us. In terms of giving you a little bit of background about Atlantic Therapeutics, who we are and what we're doing, well, we develop and market Innovo, which is an FDA-approved, clinically proven treatment for stress urinary incontinence, and that's a condition that affects at least 1 in 3 women worldwide. Innovo does that by, or the primary cause, I should say, of stress urinary incontinence is a weak pelvic floor. Innovo addresses that weakening by delivering non-invasive muscle stimulation to exercise those pelvic floor muscles, and over time have a training and a strengthening effect. Despite the prevalence of SUI, it's a very underdiagnosed, undertreated problem. I think there's a lot of reticence out there amongst women to have that difficult conversation, even with someone as trusted as a healthcare professional. I heard a statistic recently that said women are twice as likely to admit to having urinary incontinence as they are to admit to having, or twice as likely, to admit to having mental health issues as they are to admit to having urinary incontinence. So that tells you that it's quite a profound taboo. Where women do seek treatment for urinary incontinence, they're often referred to do their pelvic floor exercise or their Kegels. Very, very difficult set of exercises to do, certainly to the extent that you're having any sort of therapeutic effect. If you don't get the outcome that you're looking for, you're then referred to increasingly invasive interventions that are associated with the risk of complications and side effects and so on and so forth. With Innovo, we're marketing that directly to women. As I mentioned, it's FDA approved for direct sale to women. I think where we are in terms of our journey is we're probably a little bit more established. The technology's been on the market in one form or another for about 10 years or so. So we've been through things like the product development, the clinical trials, the regulatory approvals. We're now at commercialization stage, and I'm happy to say that we're making a little bit of a dent in the universe. We're going to do about $8 million of revenue this year, and pretty clear path to double that into 2023 and again in 2024. Our focus, I think, and this is where a lot of Irish medtech companies end up, has been aimed at the US. I think we'd love to be doing more in Ireland, and I get the sense that there's a lot of appetite for us to, solutions that are aimed at women's health. There's a lot of appetite to bring those into the Irish system as well. So looking forward to getting some conversations going about that.
Thanks, Danny. Paula, can we come to you, please?
Yeah, I'm Paula. I'm the founder of HIHI Medical, and thanks to Tanya, Health Innovation Hub, and since my 2 fellow Galwegians, thanks to Enterprise Ireland as well for this journey. Yeah, we were really excited to be part of this kind of Femtech revolution, because women's health has been underfunded, under-researched, underrepresented for far too long, and despite women, we represent more than half of the population, the world's population. And it's so nice to be in a room. I'm normally in a room where we're pitching in front of all men, nothing against them, but it's so nice to see the offset of balance here to break that taboo. So regarding HIHI Medical, we're offering an innovative solution to treat vaginal atrophy, otherwise known as vaginal dryness. And when you say this, people are creaking, but when we have done the voice of the customer, when women describe it, it's like sandpaper when they're walking, it's like sitting on a bonfire. So it's a chronic and progressive disease. It's a fact of life. More than 80% of women, if we just look at the menopause and the breast cancer survivors, suffer from it over 51 years of age. As you can imagine, it has a negative impact on a woman's health, quality of life, everyday activities, relationships, and confidence. So we propose the HIHI AV device will be the only hormone-free, natural, affordable, safe, and targeted therapy for all women suffering from vaginal atrophy. It will be clinically prescribed by a physician in an outpatient setting, and then the treatment regime will be tailored to each woman to offer monthly home use. Also, it's based on the science of wound healing, so it's based on natural therapy, using the body's own natural healing to regenerate the vaginal tissue. So we want to bring women back to the life that they lived once. It doesn't matter if they have menopause or breast cancer, everyone should live their best life, no matter what their age, especially when women are living longer, they're better informed and educated, they control 80% of the healthcare decisions, so they want to be part of this journey. We're excited, we're completing our first woman in the clinical trial in early 23 in Europe, and then end of 2023 we hope to do the US study. We also have a portfolio of other products. When you kind of delve into the area of vaginal health, it's amazing the other products we're seeing regarding looking at diagnostic to make it more kind of subjective, objective. It's quite subjective at the moment, and just looking at other scientific, life-changing, personalised solutions for all women of all ages who are a woman. Currently we're looking for an innovative kind of CEO to bring the device to the next step and be involved in this kind of change and be in this revolution to bring women's health to the forefront.
Thanks so much, Paula. And lastly, Heidi.
I'm Heidi Davis. I'm CEO and co-founder of Identify Her. It's a digital health company really developing a first of its kind menopausal symptom tracker. It's a tracker that sits under the breast and passively collects menopausal symptom data, giving objective information for the first time on the frequency and the severity of a range of symptoms. There's nothing niche about menopause, although we have been asked if there is a market when we've been in front of investors. There's nothing niche. There's about 440 million women going through the menopausal transition worldwide today, so there is a market. About 75% of these women will actually experience symptoms that are negatively affecting their lives, either at home, at work, or both. And we know that 60% of the women that suffer from their symptoms will actually go and seek medical help. And unfortunately, only 30% of the women that seek help will get treatment or a diagnosis during perimenopause. So what we want to do with our solution is to bridge the gap between the women that are in need of help for their symptoms and then the clinicians that do not have a clear diagnostic test to establish perimenopause or to track the efficiency of the management plan or the treatment plan that they're giving. We are in early phase. We have a prototype. We're working with Health Innovation Hub now to collect data to really further develop our, symptom detections. We can do night sweats and hot flushes. We are going into sleep quality and anxiety, and then further on to joint pain. So what we've done is to really put the sensors we need in this device to future-proof and be able to develop detection for more symptoms as we go. We want it to be simple, something that women can put on, wear, not having to put anything into an app or do anything manual. They can live their lives as normal. So that was one of the things we had in focus, was that women really need to just be able to go on and take children to school and do all the other things they have to do while they're getting this information. Just to say, I'm working with Health Innovation Hub, but that's been key to us to really accelerate this product development and make sure that we get the data we need to get accurate data. We're also with Enterprise Ireland. We have our DA here today. That's been really, really useful. But I think what we've seen to date is the more people we work with, the faster we can go forward. As a startup, I'm earlier than the rest of the panel here. There's very few people within the company. There's little resources in every way. So working with others, we're also working with a big company called Analog Devices. They brought us our prototype, and that's how we got a prototype within, I'd say, a month and a half from talking to them on what we needed. And that would have taken us a lot longer if we did it ourselves. So yeah, thank you very much for having me here today. And yeah.
Thank you, Heidi. So I think in the interest of time, we might leave it there because we had obviously quite a full panel. But I think kind of to reiterate what you said there, Heidi, from an Enterprise Ireland perspective and just in general, knowledge and connections and relationships are really key and can really move the dial for some of these startups. So I guess a shout out to everyone in the room if there is any introductions that can be made, any knowledge to be shared. Let's not just have the panel stop here on the high chairs. So please connect and reach out if you think that you can help support any of the companies. And also just to say, this is just a selection of the health tech companies or femtech companies that we have at Enterprise Ireland. So very much looking forward to meeting again whenever Tanya tells us to. Thank you so much.
Thanks so much, guys. I think that's very inspiring to see the products that are out there and being developed, and we know there are so many more. So we will move on to our next panel. Katrina will be at the chair. So I'll just introduce Katrina Heffernan. Katrina Heffernan makes everything happen, really. When we ask her to make everything happen, just like that, it happens. So it's great to have her here today. Katrina is the innovation lead in CUMH and Ireland South Women's and Infants Directorate. She's got a lot of qualifications under her belt at this stage. Started as a speech and language therapist, but now she leads everything from design thinking to innovation within the work that we do. And I have to say, very instrumental in enabling the focus groups that we're doing with a lot of the companies. So I think, Derval, you had a focus group there last week with a number of clinicians, and I know Katrina and Jane enabled that, so that's great. Katrina, do you want to come up and say a few words before you start with the panel there? Thank you.
Thank you very much, Tanya. So while they're getting settled there, before I introduce our panel, as Tanya said, my name is Katrina Heffernan. I'm the Innovation Programme Lead for Ireland South Women and Infants Directorate. I'm based at Cork University Maternity Hospital. And my role there really is to manage the portfolio of innovation at our organisation as we bring in new products, technologies or ways of working into the clinical space. And then also to foster a culture, to build capability and capacity around innovation activity at Ireland South, so that we can support and leverage both the intrapreneurial and the entrepreneurial potential of our staff, which is in abundance in our setting, delighted to say. So we have a long established and very successful relationship with Health Innovation Hub Ireland already, but we're really excited to see what's going to come now from this dedicated focus around women's health, and to feel the impact of it, I suppose, with the patients that we deal with on a day-to-day basis. And with that in mind, we're going to talk about impact and value. My own role as the Femtech initiative rolls out will be to be that link person between the clinicians on the ground and then our industry and research partners also active in the space. So really looking forward to what's going to come in the future. So without further ado, I would like to introduce our panel. We're going to hear from Jacqueline Keogh, who's here with a number of hats on, both as a woman, a patient, somebody who has participated in studies in the past, a cyber skills expert, and a software developer, so many strings to her bow. Sharon is with us from Cork County Council, and she is the Director of Economic Development and Tourism in that setting. And then finally from Sarah Jane Larkin, the Director General of Irish Venture Capital Association. So I don't know if you've got any particular preference around which of you go first. It's a very diverse panel, so looking forward to hearing their pieces. So who would like to go for it? Jacqueline, would you like to kick us off? Thanks.
Okay. I suppose I'm primarily here as a patient representative, but as Katrina says, I have lots of hats. I'm a software engineer. I'm obviously a woman. I'm a mother, and I'm project manager of an education program, or Pillar 3 program. So it's really, I've a long history of the industry in the software space. Your microphone, I don't know if it's working. So I have a long history as a software engineer in industry, but the networking in the research aspect is really important. In the different ones. That'll be better. Technology, don't we all love it? So I suppose it's really exciting for me to be involved both as somebody with a history in software and as a woman to see all the investment that's going on and this kind of networking event and engagement at all levels that's going on. So that's why I'm here and involved.
Thank you. Thanks a lot, Jacqueline. We'll have Sharon next, if that's okay. If you want to go ahead.
Can you hear me?
We can indeed. Thank you.
Thank you very much. My name is Sharon Corcoran, and I'm Director of Economic Development and Tourism with Cork County Council. And you might well ask, why is she here? Apart from being a woman and being absolutely fascinated by the talent that's existing in this room and just the coordination and cooperation that exists. But local authorities generally have a very strong role to play, as you probably know, in economic development of their regions. And traditionally, people would have looked at the infrastructure as being the predominant economic activity that happens everywhere. So building roads and bridges and housing and playgrounds and all of that. But about 10 years ago, government policy shifted significantly, and government policy indicated that they wanted to see local authorities become more involved in the actual enterprise development as opposed to just hardcore economic development of their regions. So you've all heard, I'm sure, of the local enterprise offices, and in fact I'm sure many of you have probably availed of their services. The local enterprise offices became part of the local authority structure about 10 years ago. And I suppose from that grew the policy around enterprise development within Cork County Council. And I'm talking specifically now about Cork County Council because I know local authorities all around the country, some of you may never have any contact with your local authority, and it very much depends on the region. But I think from a policy perspective within government, there is a driving need to get a sort of a ground-up approach to collaboration and developing ecosystems. So we would work very closely with Enterprise Ireland, particularly through the LEO offices, but in developing policy and in ensuring that we get the message out there, starting with the second level schools, going through the universities, that entrepreneurship is there for the taking, that it is a very significant career option. But to talk more specifically then about Cork, about 10 years ago, and I see Eamon is in the room here, Eamon Curtin from Ignite. About 10 years ago, Cork County Council was approached by UCC and made a very important and strategic decision, which was to become involved in part funding the Ignite programme. Now, you're all familiar with the Ignite programme is a sort of, it's agnostic, I suppose, in terms of technology and product, but it's a fantastic program that assists the entrepreneur from, from an idea creation into bringing that plan into fruition. And we contributed funding from that. You may say, well, where does that funding come from? A decision was made that we have taxpayers, like we have a wealthy tax base here. We have over 40,000 people employed locally in the FDI industry. Why don't we put some of that money back into the community? And when we say back into the community, we meant the entrepreneurial community. So the decision was made to put 1% of all income every year that comes in through the rate base, that's the commercial rate base, and to use it towards developing strategic partnerships. So an example of which would be the Ignite programme. We part fund, and I'm sure Eamon would say it's never enough, but it is about being a partner along with other partners. So I suppose that's the genesis of why the local authority is involved. And then over the last 10 years, we have developed fantastic relationships with Enterprise Ireland through the local enterprise offices and also with the Health Innovation Hub. And Dr. Coleman Casey was here before Tanya. That would have been our first contact with the Health Innovation Hub, and since then with Tanya. So like from our perspective, entrepreneurship is really, really important. Startups, starting and failing and starting again is really, really important to the local economy. And purely from a selfish point of view, it is about jobs, it's about the economy, it's about the rate base. And that's from a selfish perspective. But when I come and I look and I hear about what's going on in the room, I'm definitely going back to my bosses, and I'm going to look for a percentage to be ring-fenced for women, because I think it's absolutely fantastic. I mean, who was talking about menopause 5 years ago? And I know, because like Sally, I'm probably of that age profile where, 5 years ago, no one was talking about menopause. It's just incredible to think that we were sending men to the moon in 1969, and here in 2022, we're just starting to talk about technology that can help women's health. So I think that says it all. So sorry if I went on a bit too long, but that's my involvement.
Thank you, Sharon. We're all taking note of that commitment now of that percentage. And now, if we can go to Sarah Jane. Go ahead, please.
Thanks so much. Hi, everyone. I'm Sarah Jane, and I'm with the Irish Venture Capital Association. So our members are the venture capital and private equity funds that fund innovative startups. And you'll be glad to hear that there are, I think, many revolutions happening. We've heard today about a revolution in Femtech, but one of the things we do as an organisation is track data and track funding data. And what we can see, and we have access to our members, because having more female entrepreneurs and more female founded companies is really important on many levels. You know, the venture capital and private equity community, it's an asset class, it's a financially driven business, and most businesses don't make the best decisions if they're only talking to half the population. So even at a purely commercial level, we and our members are really interested in this. So some of the things that our data shows, last year overall, only 3% of funding in Ireland went to female-funded startups. However, when you exclude rounds above 50 million, which are, you know, really big outliers, as I think anybody who has a startup and has raised funding in this room will know and will agree that they're the big outliers. When you strip those out, funding to female founded businesses last year was actually 10% of the overall funding, which is better than 3%, but probably not really. I don't think any of us would be happy to live in a world where only 10% of the funding goes to female founded companies. What we can also see, though, is that of all of the approaches to our members last year, only 14% came from female founded companies. So what that also shows us is that when women found companies, they tend to be of really high quality, and their success rate in attracting venture capital is far higher than the average. So we heard from some great researchers today. You know, sometimes timing is you know, starting a company at the right time is as important as what you're doing and what you're founding. And I know we have some representatives here from the Department of Business. There is a really big enterprise policy white paper underway at the moment, and some of the themes that are coming out of that are around clustering, around geographical areas, and around research and development. And I think between all of those roads meeting together, there really couldn't be a better time to be considering starting and founding a company in this space today.
Thank you. Thanks a lot. I'm conscious of time, but if it's okay just to ask a quick question, I suppose, just in terms of the value and impact of the establishment of the Femtech initiative at Health Innovation Hub Ireland. I'm curious, maybe if I can ask you, Jacqueline, with your patient advocate hat on, first of all, what do you think the impact is of having this hub set up, this consolidated effort of activity from the patient's perspective?
I think it's fantastic, obviously. You know, for me, as a user of the services out there, and you know, having been involved, you know, are not seeing really much in terms of technology for female health. I think like, this is going to be a fantastic initiative. You know, most of us don't even know about a lot of the projects that are going on and a lot of the research that's going on. Yeah, the menopause campaign that was led was very impactful. Like it is everywhere, but we shouldn't have to have such a big campaign to get all of these things done, really.
Thank you. And Sarah-Jane, I'm curious from the point of view of attracting venture, is there a benefit to having this consolidation of effort in one area, obviously at a national level and hopefully international, but that kind of one-stop shop, if you like, is that beneficial to your endeavours?
Absolutely, and I think, you know, quality ideas tend to accelerate and thrive. We heard that today, you know, in an ecosystem where there are other partners and stakeholders, funders to talk to. I mean, I think we all discovered during COVID, none of us have our best ideas in a room on our own, and having a network and a hub and a focus is really important. And, you know, being able to beat the drum and attract funders and you know, be able to talk collectively about something that is going on is always much better than trying to do something by yourself. None of us can turn the tide standing on our own.
And Sharon, if I can ask you, just from what you were talking about earlier, and you've obviously been inspired by what you've heard in the room today and thinking about kind of what that will look like from Cork County Council's point of view, do you have a lens at the moment or a vision of how you think that might play out in the coming months or years now that we have established this core focus activity?
I mean, I think it's just like you were saying earlier, Sarah. I think it's the fact that when you have a clustered approach, you have a profile. And Tanya is larger than life. And I first heard about this Femtech when we were on an exploratory trip together, and Dr. Sally Cudmore was with us as well, and I just thought, wow, this is fantastic. I mean, why have we not heard this before? I mean, this is going on for years. All of this research has been going on under the radar. Why has it taken to 2022 to start talking about this? So I think you can't stop this now. I mean, we have Department of Enterprise Policy, we have the Department of Health, obviously. We have radio presenters, we have the media talking about women's health. Technology is everything now. I mean, you know, there's nothing without an app. So put the two together, and I mean, really, it's a no-brainer from our perspective. And again, getting back to, you know, the local authorities' role, I suppose, is to be facilitator, to assist. Yes, I mean, we'll always only be able to do so much financially. We're not in that big space where the venture capitalists are, obviously. But, you know, it behoves us really to encourage the startup through that journey, through the various programs that are run in the various colleges and third-level institutions, and I just think it's fantastic. I think it's unstoppable now, actually, because once you've started talking about these issues and you're discovering that everyone wants to talk, well, then there is no stopping. So yeah, I'd be very positive, and I think the Health Innovation Hub has brought real value to the local economy.
Brilliant. Thank you so much. Really interesting, diverse panel. Thank you so much for speaking, and I'll bring Tanya back to close our day. Thank you very much.
Thanks very much, ladies. Okay, so we're nearly at the end. You'll be glad to hear. I really don't have much more to say. I think we've all learned from each other. We've learned from the speakers today, and we're all charged and invigorated, I hope. And if not, can you get some coffee afterwards just to revive you again? But what I do want to say is just be part of this revolution. It doesn't matter what expertise you have. You all have a role to play in it, because everyone in this room is impacted by a woman. You were born. That's where it started. And so you can join the network. You've all had the code there, but if you have anything you want to ask us about, we have a whole team in the Health Innovation Hub that will answer your questions. And we may say we don't know, or we may direct you to someone else, but please do reach out to us. Even if you've got the tiniest start of an idea, that's what you start with, and then it moves on from there. And we will network you and link you with the people that know more than we do. So you can just send a general email to info@hih.ie, and we go from there. And of course, even if you have an idea that's not in the Femtech space, I know that's what we're talking about today, come to us with any idea in the healthcare space, because that is what Health Innovation Hub Ireland is about. This is just a focus, which, as I said, is putting us on the map internationally, bringing all the key components together. And as Sarah Jane's saying, you know, if someone comes in and says, I want to invest in a women's health product, we now have them all together in one single document, location, whatever you want to call it. Makes it so much easier to showcase what we're doing. So let's keep doing that. Let's keep part of this activity. Please come to the events that we're going to have throughout next year. And anyone that's really interested in that kind of startup idea, getting rolling their sleeves up and getting stuck in, come to those Rapid Innovation Days. I'm going to stop now, but what I'm going to ask each of you to do is chat to each other at the table for 5 minutes, because I think we're a little bit ahead of time, are we? You've probably got about, let me see. Yeah, you've got 9 minutes to talk to each other. So I'm not sure if coffee is still hot, but there's water and there's tons of sugar there. Grab something and then talk to each other. And I appreciate you all for coming today. I do want to say, sorry, I can't leave this today without saying a huge thank you to the Health Innovation Hub team. I unfortunately had to be out for about 10 days there a few weeks ago for a personal matter. I literally sent some very badly put together documents to the team, and they did it all. So I really appreciate the whole team. I'm not going to go through you all, but just really thank you.